VERRUCA vulgaris, HPV infection. So just like when we say warty looking, that means we have this papillomatosis, these finger-like tips just going out, forming this like structure. So this is a wart. We always can see in this tip, we can see parakeratosis. Sometimes between these two tips, this area we have hyperkeratosis, but from this tip and go up, we can see parakeratosis, usually something like this. Then this is the virus infection cell, we call the coilocytes, but just pay attention for this lesion. This is a really nice fresh wart. Fresh, that means this wart not stay there for a really long time. If the wart stay there for a really long time, this coilocyte changes will be gone. You just see kind of like normal keratinocytes. You won't see this coilocyte changes. Then another feature is that we also have this dilated blood vessel like what we can see in psoriasis. So we can thinking this wart is easy to get bleeding when you scratch it. And then another feature really good for a wart, that means that is really they just go inwarded, go into the same area, something like this, something like this, something like this. So there is another feature for a wart. Let's see one of the differential I can think about. That is a flat wart, also called VERRUCA planar. You can think this one, they do not have that obvious warty looking. What you can find just thickened epidermis. But when you see a little bit higher power, you can see they still have this papillomatosis, but just the line not really long. That's the reason we call this flat wart. But higher power, you can also find this coilocyte changes. So you know this to be some virus infection. And sometimes in this kind of flap tip, you also can see this parakeratosis here. So this is a flat wart. And then the last one I want to make the differential diagnosis is this one. This one we can also see kind of like warty looking, but a little bit higher power, you can see the color of the parakeratosis kind of difference. This one is kind of like hot pink, just like you light a fire on top of this wart. So when you see this really red, pink parakeratosis, and then look like a wart, you really highly suspicious this is not just a wart. And then what you can do, just check this papillodermis area. Let's find a really good area. Yes, here. You can see this foamy macrophage here. And then you can also find neutrophil, tons of neutrophil in the para and also in the epidermis. So this lesion called VERRUCA Xanthoma. Why we call xanthoma? Because we can see these foamy changes of macrophage. So this one is not virus related. What we think, just like this kind of lesion get reactive, and then they just get these xanthoma changes. So this is VERRUCA Xanthoma. And then I think